You're about to embark on a 4-year journey through med school, accumulating $250,000 in debt, with the ultimate goal of performing 200 surgeries a year at the top. You're starting at the bottom of the hierarchy, with only 1 in 10 students advancing to the next level. Get ready for the journey of a lifetime, with long hours, intense studying, and a slew of challenging exams, including the USMLE Step 1, which you'll need to pass with a score of at least 240. You're in med school, studying 12 hours a day, 6 days a week, with a tuition of $50,000 a year, which is 20% higher than last year. You're learning from experienced professors at Harvard Medical School, using textbooks like Gray's Anatomy, which has 1,500 pages of detailed illustrations. Your goal is to pass the USMLE Step 1 exam with a score of 250, which only 25% of students achieve. You're feeling the pressure, but you're determined to succeed, with 80% of students advancing to the next level. You're doing clinical rotations, working 40 hours a week, earning $30,000 a year, which is a 10% increase from last year. You're gaining experience at Massachusetts General Hospital, using equipment like stethoscopes and EKG machines, and learning from attending physicians like Dr. Adil Gawin, who has performed over 1,000 surgeries. Your goal is to get a good evaluation from your supervisors, which 90% of students achieve, and you're hoping to get a glowing review with a 5-star rating. You're waiting for residency match results, applying to 15 programs, hoping to get into a top-ranked hospital like Johns Hopkins, which has a 10% acceptance rate. You're paying $1,000 for application fees, which is 20% of your monthly income, and using software like ERAS to manage your applications, which has a 99% success rate. Your goal is to get matched into a surgical residency program, which only 50% of applicants achieve, and you're feeling anxious, with a 1 in 5 chance of getting your top choice. You're a resident surgeon, working 80 hours a week, earning $60,000 a year, which is a 20% increase from last year. You're doing 10 surgeries a month at the University of California, San Francisco, using tools like surgical simulators, which have a 95% accuracy rate. You're learning from experienced surgeons like Dr. Shafi Ahmed, who has performed over 5,000 surgeries, and your goal is to complete 5 years of residency, which 80% of residents achieve, with a 4-year completion rate of 60%. For a chief resident, overseeing 5 junior residents, earning $70,000 a year, which is a 15% increase from last year. You're working 60 hours a week, doing 15 surgeries a month at the Cleveland Clinic, using equipment like Da Vinci robots, which have a 99% success rate. You're mentoring junior residents like Dr. Lisa Nguyen, who has performed over 1,000 surgeries, and your goal is to get a fellowship position, which only 30% of chief residents achieve, with a 1 in 10 chance of getting into a top-ranked program. Remember the resident surgeons from level 4. Most of them are gone, with only 20% advancing to the next level. You're doing a fellowship, earning $80,000 a year, working 50 hours a week, which is a 10% decrease from last year. You're getting specialized training at the Mayo Clinic, using techniques like minimally invasive surgery, which has a 90% success rate. You're learning from experts like Dr. Eric Kuo, who has performed over 2,000 surgeries, and your goal is to get certified by the American Board of Surgery, which 85% of fellows achieve, with a 95% pass rate. You're an attending surgeon, earning $200,000 a year, working 40 hours a week, which is a 20% decrease from last year. You're doing 20 surgeries a month at New York Presbyterian Hospital, using equipment like 3D printers, which have a 99% accuracy rate. You're teaching residents like Dr. David Lee, who has performed over 500 surgeries, and your goal is to get a reputation as a skilled surgeon, which 75% of attending surgeons achieve with a 5-star rating and 1,000 patient reviews. You're the chair of the surgery department, earning $300,000 a year, working 50 hours a week, which is a 10% increase from last year. You're overseeing 10 surgeons, managing a budget of $1 million at the University of Chicago, which has a 15% increase in funding from last year. You're using software like Epic Systems to manage patient records, which has a 99% success rate. And your goal is to get a promotion to hospital administrator, which only 10% of department chairs achieve, with a 1 in 20 chance of getting the top spot. You're a hospital administrator, earning $400,000 a year, working 60 hours a week, which is a 15% increase from last year. You're managing a staff of 50, overseeing a budget of $10 million at the Hospital of the University of Pennsylvania, which has a 20% increase in funding from last year. You're using tools like data analytics to improve patient outcomes, which has a 90% success rate. And your goal is to get a position on the hospital's board of directors, which only 5% of administrators achieve, with a 1 in 10 chance of getting a seat. You're a surgical researcher, earning $250,000 a year, working 40 hours a week, which is a 10% decrease from last year. You're conducting studies, publishing papers in journals like the Journal of the American College of Surgeons, which has a 15% acceptance rate. You're using equipment like microscopes and PCR machines at the National Institutes of Health, which has a 95% success rate. And your goal is to get a grant from the NIH, which only 20% of researchers achieve, with a 1 in 5 chance of getting funded. You're a surgical innovator, earning $500,000 a year, working 50 hours a week, which is a 20% increase from last year. You're developing new techniques, creating medical devices like surgical robots at the Medtronic Innovation Center, which has a 99% success rate. You're using software like CAD Design to prototype your ideas, which has a 90% accuracy rate. And your goal is to get a patent for your invention, which only 10% of innovators achieve, with a 1 in 10 chance of getting approved. You're a world-renowned surgeon, earning $600,000 a year, doing 200 surgeries a year, which is a 25% increase from last year. You're speaking at conferences like the American College of Surgeons, using a podium and microphone, and operating on celebrity patients like Beyoncé, who has a 99% satisfaction rate. Your goal is to get into the Surgical Hall of Fame, which only 1% of surgeons achieve, with a 1 in 100 chance of getting inducted, and you're feeling proud with a 5-star rating and 5,000 patient reviews. You've climbed the hierarchy of a surgeon, from med school to world-renowned expert, earning $2 million in salary, but spending $500,000 on education and training, which is a 20% return on investment. You've done 5,000 surgeries, saved countless lives, and achieved a 95% success rate, with a 5-star rating and 10,000 patient reviews. The cost is high, but the reward is worth it, with a 1 in 10 chance of getting into the Surgical Hall of Fame, and you're feeling fulfilled, with a sense of pride and accomplishment, knowing you've made a difference in the lives of your patients.